Malea Jensen. I'm a board certified family medicine. Welcome to another episode of Dr. J's Prescription for Health. It is Sunday, August 11th. It is 12:30 Central in Iowa. Hi, Jeff. Hi, Instaesh. And Nikki has joined us. Matt, thank you for joining. We'll wait a little bit for everybody to come on. We are live on Instagram and YouTube at the moment. Hi, Carol. So if you guys have questions regarding your health, regarding diet, exercise, cholesterol, 6:28 in England. I was kind of wondering what time I should come on today. I was thinking around noon would be the best time to avoid or to intermingle with the church services. So I'm glad to see you, Emma. Thank you for joining. Nikki says, I'm so excited to go and get my blood drawn. I've been on carnivore for 3 months now, trying to get rid of my kidney disease and diabetes. Nikki, we wish you the best. We can't wait to hear how your labs go as well. Just make sure that you are obtaining a fasting insulin as well as a lipid panel, a CMP, a CRP, high sensitive CRP would be best. Make sure you're checking your thyroid, a CBC. Okay. And if you want, you can get your hormone levels checked. I don't know where you stand with those, but that sort of thing will give you a lot of information. Getting an A1C, make sure you don't have diabetes. However, most of you are well aware that the A1C can sometimes be thrown off when you are eating a carnivore diet. So getting a glycated hemoglobin might be in your best interest, a glycated albumin might be in your best interest. Nikki says, my hormones are screwed. I'm going to rewatch this so I can write everything down. Nikki, do you have a pen? I can repeat it. I go a little too quickly sometimes, but if we have an A1C and a CBC and a CMP, that's a complete metabolic profile. You want to get a lipid panel. JM, it is live. Thank you for joining. Nope, we are live, JM. Thank you. So an A1C, a CBC, a CMP, a lipid panel, a fasting insulin, and you want to check a thyroid panel. You want to check a TSH, a T3, a T4, a reverse T3 if you've never had that done. And you might want to check your thyroid antibodies. So there's 2 of those, thyroid antibodies. Okay. You want to get a high sensitive CRP. Nikki says she has an A1C of 5.6 and they wanted to put me on meds for that. What meds would they be putting you on for an A1C of 5.6? Hi, Miss Kelsey. Thanks for joining. JM says, my wife does keto to help her with PCOS, pregnant with our 3rd. Awesome, JM. She's also probably more fertile being a keto. So congratulations on your 3rd baby. Awesome. Did I miss a question in here? Nikki, did you get those all written down? I hope so. You're welcome, JM. So you guys heard of a saying. Have you heard of a saying that the less you know, the more confident you are in whatever information you're giving? It's called the Kruger-Dunning effect, and it's pretty interesting. Hi, Assad. Thank you for joining. Hi, Sherwood. Back to Nature says, hi, Doc. I'm a Thompson, naturopathic holistic medicine practitioner from Nigeria. Ah, well, thank you for joining. I know you've been on before, so I appreciate you joining in. Okay, Nikki, you can catch some of those again. Poi says, will Medicare pay for all of these labs? That's a great question. They may not pay for all of those labs. It depends on if you have a diagnosis code that helps you with those labs. For instance, if you've had hyperlipidemia in the past, it'll pay for a lipid panel. If you have insulin resistance or glucose intolerance, it'll pay for an A1C. Even if you've had hyperglycemia, so if it's over 100, your glucose, that should get a diagnosis code of hyperglycemia or glucose intolerance, and you should have that paid for. But again, you are relying on, here, let me wipe this. I got to wipe this here. Oh, that's better. That's much better. You have to rely on your doctor for actually putting the right diagnosis code to help you get things paid for. So it's almost like you're at their mercy, which is wrong because the doctors should be working for you and your benefit. But a lot of times they're not. They really don't care about your finances, to be perfectly honest. Well, some of them do. I don't want to, I don't want to say it's all doctors. I don't want to say that. But if you have fatigue, if you tell them that you have fatigue, that'll pay for a thyroid. That'll pay for your CBC, and it might pay for an A1C. Fatigue as a diagnosis code plays a huge role and can cover a lot of your lab tests. So, ask your doctor. Ask them to be considerate. Oh, JM says, I got to go. Liked and subbed to help with the algorithm. You seem nice. Good luck with your channel. Thank you, JM. CC Passion says, good morning. Hey, Dan Brown, thank you for joining. Lacrosse Mom, thank you. Yes, boy, so the fatigue, yes, that will help pay for some of your other tests as well. Hypothyroid, you want to make sure, though, you're checking all of your thyroid, the T3, the T4, both free and, so free T3 and total T3, free and total T4. You want to get a TSH and a reverse T3. You also want to obtain your thyroid antibodies if they have never been checked, okay? That's very important. You want to make sure that you don't have Hashimoto's. If you have Hashimoto's thyroiditis, sometimes that is a little harder to treat versus just a simple hypothyroid. So obtaining, just even for the one time, will help you diagnose your thyroid disease. Jacob says, is this on a catamaran? No, I would say it's not on a catamaran. Yeah, boy, just get a reverse T3. The reason for that is, let's say, well, this is difficult to understand, but I'm going to give it my college try here. Our thyroid produces T4. It produces nearly all of your T4, 100%. And it produces a minor portion of T3. In the periphery, your T4 will convert to T3 and a little bit of reverse T3. However, if your T4, if there is a disruption or a defect in your T4 going to T3, you're going to get some reverse T3. And reverse T3 actually blocks the ability for T3 to hit its receptor. So it's almost like reverse T3 hits the receptor faster than T3. And again, this disrupts our thyroid function. And not a lot of doctors check reverse T3. So just checking it even one time will help you. Okay? I know not a lot of doctors will check that. You're very welcome, Poi. Thank you. Hopefully I'm pronouncing your handle correctly. That was a good question. Let me make sure. I'm going to back up here and make sure I did not miss any of these. Okay. So if you are listening right now, we're listening, if you are live on Instagram and YouTube, where are you listening from? What city, what state, what country? Tell me where you're listening from. This is your chance to ask questions. So earlier, while I'm waiting for anybody to chime in here, earlier I was reading in one of my books, and they were talking about why doctors seem to stick with something that they have been taught without ever, like, how can they stand their ground on something when knowingly it's probably not right? Okay, let me give you an example. It seems that the less we know, the more confident we appear to be, or seem to be, or even believe that we are correct. And I will tell you that is probably why doctors stand their ground on certain subjects. For instance, LDL as the cause of coronary artery disease. And you say, if they would just, you guys as listeners, if they would just know what I know, they would never stand their ground like they are right now, because it's wrong, right? LDL is not the cause of coronary artery disease. And I've said this over and over again, that just because the ambulance is at the scene of a crime does not mean that the ambulance caused the accident. Okay? So just because we may find LDL at an area of plaquing or a clot, does not mean the LDL caused that. In fact, this is where the opposite of the Kruger-Dunning theory holds true for myself. I get to the point where the more I know, the less confident I am. The more I know, the more I realize there's more to know. Okay? And not a lot of doctors, and Dan just mentioned it's called ego, doc. I understand. People don't like to admit when they're wrong. You are absolutely right. But one of my things we are, as a doctor, are held at a higher standard, okay? We went through the education. We should be the one that are sharing with you guys truth. We shouldn't just hold firm on our beliefs of the past 30 years. And by the way, I have been in practice for 26 years, and probably, I almost hate to admit this, 21 or 20 of those years, I spent under the influence of the lipid theory of coronary artery disease. Okay? And what I mean by that is I was bamboozled just like everybody else. I was taught that LDL was the cause of coronary artery disease, and I stuck by it. I stuck by it until some patients of mine helped me realize that there could be something different, okay? There could be another hypothesis. And it really wasn't as difficult as you think it was to admit I was wrong. Could that be for some others? But it was almost liberating, you guys. It was almost liberating that I got out of my narrow blinders, okay? And I thank the patients that set me straight or helped set me straight, okay? Because I really had to do the work. You can present the information to me, but I really had to do the work. And so, just when I think I know enough about LDL, or I know the mechanism of injury in an endothelial lining of the artery, the more I don't know. I continue to learn every single day from doctors specializing in this. And sometimes it's overwhelming, just like it is for you guys listening right now. It gets overwhelming. Like, what am I going to do? Just tell me what to do. And I know that sounds easy, and I know it seems comfortable to have us tell you what to do. But in all reality, I need you to help yourself learn as well. So these things that you maybe don't need a doctor. You might need them to order your tests. You might need them to stitch on your finger back on after you cut it off with a saw. But these other things, we have to look at how doctors may be a leading cause of harm. Okay? I almost hate to say that, but it's true. And so, as others have mentioned, you have to be an advocate of your own health, okay? And that can be hard, because even the doctor is admitting to you that there's so much information, there's so much to weed through, that sometimes we don't even know what we've taught was the truth or not truth. I mean, it's that bad. But I want you to know that I will continue laboriously to continue reading, to continue listening to other sources of information that will help you make better decisions. For instance, if your doctor, like Nikki says that her doctor with a 5.6 A1C wanted to put her on a medicine. I don't know what that medicine was. Are they treating you with, they're saying that you're pre-diabetic and that you should be on a diabetic medicine, or you're pre-diabetic and you should be on a statin? Okay. No longer, you guys, are we being paid. We personally, as a physician, are not being paid to place you on medications. Okay. Especially knowingly it's a generic medication. There are absolutely no kickbacks. Okay. The doctors who continue to believe that LDL is the cause of coronary artery disease, placing you on a statin, may or may not know why they're even putting you on a statin, except for they've been told that for years upon years. Okay. Remember, you guys, even though we have all this education, doctors have a lot of education, we are still guys and gals. We are real. We make mistakes. And I don't want you to, I want you to give us a little grace. But if the doctor doesn't want to advance their learning or advance their skills, then what grace are you going to give them if they truly don't want? It's the same thing as if I tell you that doing a certain meal or diet protocol will help you attain your goals, and you choose not to do it. Or I tell you that you are a setup for type 2 diabetes, and you say, I really don't care. It's what I choose to do, and I'll just take the medicine if it's available. Then it's on you. It's not on the doctor. Okay. But the more and more I read about this LDL, and I listen to you guys talk about, Terry, if you hold that question on what's good for anxiety, I will get to it. I promise you. I just want to finish my thought process here on LDL. Siraj wants me to say his name. So hi, Siraj. We are live on YouTube and Instagram right now. But hi, Peanut. But what I would like to tell you to learn about is if LDL is not the cause of coronary artery disease, what then is the cause? And I would appeal to you that it's a couple of other things. Inflammation. So the lining of the arteries are inflamed. And a second component of coronary artery disease is going to be clot formation. Okay. If a doctor is telling you that it's LDL cholesterol. One, hear me out. You need to call them out on LDL cholesterol. LDL is not cholesterol. It's a particle that carries cholesterol. Okay? 2, the LDL particle is so big, it can't penetrate the endothelial lining. Okay? 3, these are simple. I am going simple things right now because I want you to get your doctor to think. Okay? What the third thing is, if LDL was the cause, LDL floats freely through our bloodstream in both arteries and veins. Why does it only cause problems in arteries? Why not veins? Why don't we get plaquing buildup in veins? Good question, right? But think of this. When you have a what am I trying to say? A cabbage. If you've had a coronary artery bypass graft, where do they get that graft? Usually a vein, right? You take it out of your leg, saphenous vein. They use it to repair the artery that was damaged in your heart. Then, is there a chance that you can get an injury in that new vein? Yes. So if the vein was originally where the vein was supposed to be, no LDL plaquing. But if the vein goes where now it's acting like an artery, plaquing. Okay? You say, how can that be? Could it be that it has to do with inflammation? Could it be due to the pressure it's under, the blood pressure? See, these are all the things that your doctor wouldn't even have remote access to unless they were studying this on a regular basis. And if the LDL only hits the arteries, why is it that it only hits a certain area? And then 3 millimeters either side of that injury is healthy endothelium. Okay? What caused the injury? And we could come up with a number of different things. You could say, Dr. Jensen, I know what you're thinking. It's got to be sugar. Well, it could well be sugar. Okay? The endothelium has to be damaged in such a way that the junctions are no longer tight. Okay? Something has to penetrate the injury. There's got to be an injury in order for something. All of the things that are floating around in our bloodstream help to make a clot, help to make a plaque. Okay? And let's say you have an injury. Okay? And what is it that comes to the rescue to help patch this up? All of the things in the blood. You got red blood cells, white blood cells, you got fibrin, you have, you got platelets. All of these things come to the rescue. Macrophages. All of them come to the rescue to help patch this up. And so, could you develop an area in there, in that artery lining, because of that injury? And then we lose all of the protective mechanisms, okay? So you have an injury, and then you got these things that race to it to bandage it up, okay? And that plaque is penetrating your endothelial lining. And normally in your body, there's these endothelial cells that they're like progenitor cells, right? They come and they try to build an endothelium on top of the plaque. So there's a lot going on to simply just say it is LDL which in and of itself could never penetrate the lining because it's too big. So now we get into this, the LP little a or LPA. So some of you have heard about an LP little a, and you'll say, I had my doctor get me one of those, and it was elevated, and they told me that it was hereditary, and there's nothing I can do about it. I don't believe that, because I have seen studies that show that the higher your carbohydrate diet, the carbohydrates are in your diet, the higher your small dense LDLs. LP little a being one of those. You see, LP little a is called LP little a because it's a lipid particle. It's an LDL with an ApoA attached to it, whereas an LDL has ApoB attached to it. So LP little a has ApoA attached to it, lipoprotein with an ApoA. An LDL has an ApoB. That's where you guys are starting to think and say, oh my gosh, why is this ApoB so important? Because that is a protein attached to an LDL particle. And so they say, if we get an ApoB, now we have maybe a more accurate LDL reading, because for every ApoB, there's an LDL. But the LP little a with the ApoA is able to penetrate that lining. Okay? And you say, why is the lining abnormal in the first place? The endothelial lining. Now we can get into why the injury occurred, why the clot's occurring, why there's no nitric oxide. Nitric oxide is the biggest vasodilator that we have in our body. So why isn't your body making enough nitric oxide? What's blocking it? Could it be insulin? Could it be sugar? So these are all the things that I know sound overwhelmingly confusing, but your doctor is trying to put it in simplistic terms and say, I'm going to check your lipid panel. Your LDL is over 100 and whatever they say the number is, because whoever made these numbers up, they just moved the goalposts. When I first started 26 years ago, a normal LDL was 160. Now we want people down to 70 or 40. Okay? I will tell you something. We need cholesterol. There are actual studies that show that we have a need for cholesterol as we age, and that the more LDL you have, the longevity increases. So that seems odd. I have patients listening, or people listening, that get a lipid panel in their 70s, have never been on a cholesterol medicine, and their doctor puts them on a statin. I would rethink that if I were you, about going on a statin when I'm gracefully aging, okay? Because you need your cholesterol. You need it for your brain, you need it for every cell in your body, and you need it for your hormones. So there's got to be something else that we can treat, okay? Because something else is causing that injury, and that likelihood is diabetes. Diabetes is the greatest cause of coronary artery disease. If there is a chance that you are going to have a cardiovascular event, a heart attack, if you have diabetes, your risk goes up exponentially. If you smoke, have high blood pressure, that even makes it worse. So you're getting all of this inflammation built up in your body, okay? Simply by what you're putting in your, eating, okay? Let me see where we're at here. Dan says education is only as good as the people who gave it to you. Yeah, that is true. You would hope that we would continue instead of getting stuck in what we were taught. That goes for anything. You think about a financial advisor. Don't most financial advisors, hopefully financial advisors will go the extra mile and continue their continuing financial education. But you have to understand that when we do CME, continuing medical education, it's by the exact same people who promoted the exact same information in the first place. It continues. So if we go to CMEs, they're promoted by the exact same people, big food and big pharma. Okay. They're teaching us the exact same thing over and over and over again. So do you think that it's easy to jump out of that matrix and relearn things? It's very difficult. But there are doctors now opening up, and they're jumping out of that box and trying to learn, because we truly want to help people. Hey P Dub, hi Gregory, hi Janie. Yeah, Dan, I agree that people do tend to believe the first thing they hear. It is, I think it goes to a point of convictions as well. It is very difficult, like you mentioned before, it is very difficult to admit you're wrong, and then you have to relearn it. But if we continue to have different information presented to us, it begins to convict us. If we are convicted, we have to unlearn what we've learned in the past and relearn new things. And, that's a part of life. But obviously not a lot of doctors do that. Yeah, especially in the medical corporate arenas. And I'm in private practice, so I'm on my own. I went out on my own 12 years ago to get away from corporate. You are not away from insurance companies. You're surely not away from the medical board, but there's less big brother overhead. PB says, the majority of doctors get bothered when you ask why you should follow their recommendations. Or are they bothered because they're offended? Are they bothered because now I have to take 20 more minutes to explain myself? I'm not sure. Here's how my patients did it with me is I know this sounds crazy, but because we're not supposed to get gifts, but my patients brought me books to read. My patients sent me articles or photocopied an article to have me read. And they just said, Dr. Jensen, I know that you have you don't have a whole lot of time, but I read this and I'm just curious what your thoughts are. Could you read it and then maybe get back to me? I'd make an appointment to go over it with you. That's how it started. And I love to read, so when patients brought me books, I read them, and over and over and over, yeah, it came true. So anyway, Lacrosse says, have you know anything about UTIs and low T3? My 87-year-old mom, a puzzle. Her endo doesn't want to ever do any testing. She is on Tirosint, and they said no need to test. She was tested last April. So help me out here, Lacrosse. I'm not huge on all of these new medicines. What is Tirosint? That is one I'm not familiar with. Dan says, people in authority positions don't like to have their authority questioned. Doctors are in authority positions. It's true. It's true. Back to Nature says, hi, Doc. I am CEO. Back to Nature. Thanks for the tutorials from Nigeria. Thank you, Nigeria. Okay, Lacrosse says, Tirosint is pure levo, no fillers. So it's still synthetic, right? So Tirosint is still a synthetic. I'm guessing T4. Okay. So, you've asked them to check. You know what's likely happening, and I hate to speculate like this, but you said your mom's 87. Like, what kind of health is your 87-year-old? Because most doctors are going to say, you know what, your mom's 87. She's lived a darn good life. Let's just keep her on these things. And why treat, I don't know, but why treat an 87-year-old Medicare patient with a brand name medication that's going to cost her $200 a month? I have no idea what it costs, but I'm guessing if it's branded, it's going to be very expensive. And to say that there's no need to check T3, T4, TSH, reverse T3, your thyroid antibodies, it's a shame. And it's doctors like that cause disasters. It just leads to one disaster after another. Okay. And it's really unfortunate. Mm-hmm. And sometimes, if you plead with your doctor and say, hey, could you just check these things, and they deny you, it might be time to check for another doc. Okay. I know that's tough to say, but PB says you are exactly correct. Yeah. For those of you just joining, where are you listening from? We jumped on about a little over a half hour ago. I am Dr. Malea Jensen. There's a lot of new names in here. Usually I do morning routines here on Instagram and YouTube and Facebook. There's E. Hackett. Thank you for joining. So usually I am in the morning, so I'm hitting a whole new crew here. PB says Colleyville, Texas. Welcome. Thank you. I am a family practice physician. I am in West Des Moines, Iowa, and I've been practicing for 26 years. So Lacrosse says, yes, she was switched because Synthroid gave her rashes. Yes, I need a new doc. Thank you. You're welcome, Lacrosse. It's unfortunate, it really is, but you need to get more information. If your doctor does not know how to, visualize different labs, then maybe they need to go, and you need to find a different one. That's all I can say. Joanne is listening from Troy, Michigan. So are you a Spartan fan, or are you a Wolverine fan? Or Joanne, where do you sit with I'm going to tell you, my dad went to Michigan State and my mom went to Western Michigan, and I am a Wolverine through and through. However, I support the Michigan State Spartans because my dad went there, and this is actually his hoodie that I wear on as much as I can. My dad passed away in 2018, and I miss him, and this is one way I can stay close to him. That and my prayer. Nikki says, I have kidney disease because of old chemo and want to get a biopsy. And they want a biopsy. I said, no, that's when I went on chemo, and they want me on statins for an A1C of 5.6. Okay. Nikki, I'm trying to understand. You got to be a little, I have kidney disease because of chemo. And they want to do a biopsy. I'm guessing that's what you meant. I said no, and that's when I went on chemo, and they want me on a statin for an A1C of 5.6. Did you ask them why they're recommending that? You have to get more information, because right there is not enough information. Hello, Galway, Ireland. Thank you for joining. Is it Nia? Celebrity says, I have an autoimmune disorder, chronic hives. Does this cause high inflammation? All autoimmune disorders are inflammatory, okay? You have to ask yourself why you have the autoimmune disorders. Is it something you're eating? Is it medications? Is it lack of sleep? Is it stress? Is it other things that are going on? But I would likely want to find out why you have an autoimmune. Most commonly, it is from either medications or something you are eating. Oh, Joanne says, sorry, I'm not into sports. That's okay. Just was asking. Nikki, you're now carnivore? Okay. So that's good. You just got to give it time and see if your carnivore will turn things around and turn around your kidney function, which I think it will. Lacrosse says, you may have already spoke about this, but what is your take on this egg yolk and COVID study that is going viral? I have not heard about the COVID study and egg yolk. I am guessing that, let me guess, I don't even know what this is. You eat egg yolks and you'll protect yourself against COVID? Because I think egg yolks will protect against everything. But let me know. Hi, Brian. Thanks for joining. Jan. Celebrity says, I have tried many doctors, but they just want to put me on an autoimmune suppressant, so I have changed my diet and lifestyle. Hope this helps. Celebrity, I think you've made the right choice, and we would love to hear how things go in the future. But, you know, there's always time to go on an autoimmune drug. I mean, you got plenty of time. I don't necessarily think you should jump into something that is injected into you, but it's okay. What else? So let's talk a little bit about, we talked about this yesterday, and I'm sorry if some of you were on yesterday, but you want to hear some more information, and that is a calcium scoring test. Have you had a calcium scoring test? Those who are listening, what do you know about calcium scoring tests? Is your doctor for them, against them? Do you even know? Because before they put you, hi NC Matt, thank you for joining. So before going on a statin for an elevated LDL, I need you guys to look at your triglyceride levels. I need you guys to look at your HDL levels. Those two things plus a fasting insulin will tell you a lot. Then you add a high sensitive CRP, and we'll be able to tell what type of how much inflammation that you have in your body. But again, if you have high fasting insulin, you know that you probably have quite a bit of inflammation going on in your body, and we need to reduce that. How do you reduce insulin levels? Low carb diets. Keto, ketovore, carnivore. Those are low carb diets. And they've been shown, there's more studies on keto diets than any other diet that you could think of. Keto diets. Yet, your doctor has probably never read them and likely never will and does not believe in them. In fact, they would rather push a diet that has very weak studies than to put you on a diet that has very good studies. Okay. So when talking about a calcium score, the information you want to get from that is not just the number, like 0. There's more to it than just knowing your score. You want to know the density of your plaque. You want to know where it's located, what's the distribution, okay? And you also want to know the volume. What is the volume of your plaque? And if you get a place that really has good calcium scores, they'll give you all of that information. If they don't, you ask them to reevaluate your calcium score and to give you those values, okay? So we want to know the density, the distribution, and the volume. Those are the 3 things that you want to know about your plaque. And remember, a calcium score is a score of regarding your hard plaque. It does not show soft plaque. Only a CT angiogram will tell you about your soft plaque, okay? It's possible, you could have a normal CAC score, 0, and have a soft plaque. It is possible, but the chances, your risk of having a cardiovascular event with a 0 score is pretty small, like 5%, but it's possible. I don't want to say it's unrealistic because it is. I have personally not seen it, but Dan Brown says, do you ever worry about being shunned by mainstream medical establishment? Worry? No. But Dan, all doctors are human beings, and we do not like to be told we're wrong. It hurts because like I said, we are highly educated. We're not a lot of us are geniuses. I mean, there's some geniuses, but really we were just really good at passing tests in undergraduate and medical school and having a desire to be number one or to do well. It's a desire, it's a will, it's how you're brought up. It's something that is inside of us to want to do well. And so when we believe something that the majority of the medical community does not believe, and they bombard you, yeah, that can be hurtful. That doesn't feel good, of course, okay? But I have to get past it, and I have to know that I need to continue to speak truth. And that can be hard, but it's really, really easy when you have God on your side, okay? I feel strongly about my faith, and I feel strongly that He leads me and guides my footsteps and guides my words in His glory. And until I hear differently, then I'm going to continue on this trek of finding out what is the real cause of coronary artery disease, why we get diabetes, why people need to, approach their diet and their exercise and their sleep and their stress in certain ways to protect them. But if that's only if you want to help yourself stay healthy. If you want to believe that because you age, you're going to get a disease, then you keep believing that. I do not believe that we will get disease as we age. You do not have to get diseases if you are aging. You could just live to 120 without a disease. But yet, the society and the culture has made it appear that as you age, you're going to get something. You're going to get cancer, heart attack, you're going to have a stroke, you're going to get diabetes, you're just going to get the things. You're going to get thyroid disease, everything's just going to give up. You're going to get kidney disease and you're going to need dialysis and might as well just die. Well, I don't live like that. I live as if I'm never going to get a disease. But I have to work on not getting diseases, right? Because we know how prevalent they can be. And if we want to continue in our desire to feed our flesh and live in this world, then there's a strong possibility that you are going to get diseases, okay? Because you are going to eat like nothing matters. And if big pharma and big food know that, they're going to continue to feed you poison things that you put in your mouth. It's not food. I can't call it food because it has no nutritional value. The things most people are eating, I don't know if you out there are listening. I don't want to group you because if you're listening to me, you're likely not eating a standard American diet. Okay? You are wanting to learn more about staying healthy with a keto or ketovore, carnivore, lion diet, right? Am I wrong in stating that? Because most people who jump on here want to reverse their diseases. And any doctor who tells you, like Joanne, who's commenting about her type 2 diabetes, any doctor who tells you that you are destined to continue to have your type 2 diabetes and cannot reverse it, it's not reversible, you should really try to find another doctor, okay? Because I've seen plenty of them, and apparently I reversed my type 2 diabetes to normal numbers by going on no carb. I mean, there's just one. So if people continue to tell their stories about how they reverse their diabetes, the medical community is not going to be able to deny it much longer. Okay. PB says, talking about getting older. We're all getting older every single day. Every single day you're alive, you're getting older. every single day, you are one day closer to being with God. What are your thoughts about enlarging prostate and PSA within normal limits? So PB, does that mean that you went to a urologist and had a prostate exam? They said your prostate was large, but the PSA came back normal? Is that what you're saying? Or your PSA was normal and you still went to the urologist because you were having symptoms of your stream? Okay, your husband. So I need a little more information. Was your husband having symptoms? They did a PSA, it's normal, and then your husband's having symptoms, or you just simply went to your urologist, they did a PSA. Okay, so he is having issues with his stream. The PSA is normal, and he goes in and he's got an enlarging prostate. Okay, that's inflammation. That's benign prostatic hypertrophy. So praise the Lord, his PSA is normal. It's not cancer, but he's got a large prostate. And so that's an inflammatory process, just like all the other inflammatory processes in our body that we can reverse, usually with diet. Is he, your husband, a diabetic? Or prediabetes? Somewhat. Okay, so there you go. If he reverses his prediabetes, diabetes, high insulin, somewhat? No. Okay, I'm not following. So Janie says, my daughter started keto diet 2 months ago and still having carb cravings. My assumption is due to substitute foods for desserts, etc., that keep cravings going. Okay. A real keto diet is basically high-fat meat and maybe a little veg. So if they're eating keto products at the grocery store, that's not a keto diet. That's a crap diet. Might as well be on a standard American diet. And so how would you expect a person to ever get rid of their carb cravings when they're eating fake keto stuff that somebody is selling you to make money off of you, to appeal to your senses that it's keto? If somebody tells me my keto bread is keto, then that's not really food and it has no nutritional value and you're being deceived. So it's no wonder that your daughter is still having problems after 2 months. She needs to get off of anything that comes in a box or a bag. Mimo says, do you have an OnlyFans account? Not on YouTube. I do not. I have one on Facebook and I have one on Instagram. Thank you for your question. P. Bunkley says her husband is non-pre-diabetic. What's his insulin level? Did he get an insulin level? Did he get a CRP? These are the things that can indicate whether or not he has some inflammation going on. Did he change his diet? Have you tried going 30, 60, 90 days of carnivore and seeing if his prostate symptoms got better? I would assume that they would get better. Okay. Let me go back, make sure I didn't miss. You guys didn't talk about COVID viral study is. Hi, Carmen. Thanks for joining. We're just taking questions regarding your medical concerns. I am going through and making sure I did not miss anything. His doctor is very limited on labs. Limited on labs he draws, limited he won't do them. There, you guys, if this no CRP and no calcium, calcium is on your calcium level, if that's what you mean, is on your complete metabolic profile. It is there. But a CRP will need to be ordered extra, as will everything else. And if you guys are having trouble ordering your stuff, you could, I know it costs extra money, but you could go to ownyourlabs.com and order your own labs. Yes, you will have to pay for it, but I tell you, it might be worth it. Just a one-time deal that that you order yourself and just get it paid for. You do not need a doctor's order to own your labs. You order it yourself. Dan Brown, oh my gosh, is that what you meant? Doc, I can tell you don't know what OnlyFans is. That was a very bad question. Oh, okay. Call me naive, Dan. Okay. How does calcium affect what? You guys, I love your questions, but you have to be a little more concise. And it is hard for me to follow if it's not just you and I talking. There are other people like joining in, and I will lose your questions and your answers. So it's very hard for me to follow. How does calcium affect prostate? I'm not sure. That's okay. You didn't know. So just put your whole question in there as concise as possible. Okay. So since we're talking a little bit about inflammation and diets, Penny says, what about fiber on the carnivore diet? I would say, Penny, if you're on a carnivore diet, you do not need fiber. Fiber has no nutritional value. It irritates the inner lining of your colon. And if you are truly on a carnivore diet, you have nothing going to the large intestine. Almost 95% to 99% of everything you eat, beef, butter, bacon, and eggs, is absorbed in the small intestine, and nothing goes to the large intestine. We're paused here. The reason you need fiber in the standard American diet is because the crappy foods ferment in your colon, and you require fiber to get that out, and in a bowel movement. The reason people have bowel movements on a standard American diet is because they didn't absorb any of the crap that they put into their mouth, and so it has to get out sometime or it'll rot. So that's why people do not need fiber on a carnivore diet. PB, that calcium level of 9.3 is fine. If your level goes over 10, if your level is going 10, that's when you need to start looking into it. And it's for other reasons besides your prostate, okay? A calcium level of 10.1, you want to get a parathyroid hormone and check to make sure nothing else is going on, because why is your calcium level elevated? Are you leaching calcium out of your bones? And that would not be a good thing. If you start taking calcium out of your bones and teeth and you have hypercalcemia, you need to check into a parathyroid hormone, PTH, parathyroid hormone. Okay. Penny, I hope that answered your question on the carnivore diet and fiber. Hi, Yoga. Thank you for joining. Yakita, thank you. Let me make sure I'm not missing questions up here. Hi, Miss Ash Myers. I didn't see you join in here. Dan, yes, thank you. Dan Brown, I bet you have a question. Do you have another question? You seem like you always have questions for me. So if we were following what do you guys consider a healthy diet, healthy exercise program. If you were doing an exercise program, what do you think is most important? Do you think it's cardiovascular? Or do you think it's lifting weights or lifting heavy things through space? Do you guys exercise at all? Why are we told to exercise? You're told to, the American Heart Association tells everyone to exercise 150 minutes a week. They don't tell you what. They don't tell you why. Okay? But if I had a choice, and knowing what I know, that muscle is the organ of longevity, I would encourage everybody to lift weights every single day. Not the same body parts, split it up. You might want to do arms one day. You might want to do legs another day. You might want to do chest another day. You want to do back another day. Split it up. You got 7 days. You don't need to spend 2 hours in the gym. In fact, some of you don't even want to go to the gym. But you can lift heavy things at your home. You can start out a workout program with bands. Do resistance bands. You can look up a exercise routine on YouTube and you're on your way. And then as you advance through the band workouts, then you go to strength training with weights or lifting heavy batteries in your barn. Okay? Now, just as an aside, I am a doctor, but I'm not your doctor. This is YouTube and Instagram, and honestly, this is for information purposes only. A little bit of entertainment along the way. But again, I am not your doctor, and this is not medical advice. So I'm just trying to help you navigate your health so you have more information to take to your doctor. This is just another set of eyes on your health. That's what we're here for, okay? So if you are wanting to consult with me to go over your labs, yes, you can call our office. It's 515-267-1961. You can just schedule a video conference and we can go over your labs. Just a one-time deal. And it's anywhere from $65 to $90. So it's not extremely expensive, okay? But it gives another set of eyes on your labs to help you make decisions, to help you gather enough information so you can ask your doctor more questions, okay? Janie, you're correct. Mobility and strength training are top-notch. So keeping mobile as we age. So yes, you want muscle, but you also want to be mobile. As we age, most people know that we just start sitting on our butt, doing crosswords and watching TV and playing on our phone. Like, what are those games, those card games? Yeah, we got to be mobile. We got to stay active. And just spending 1 hour in the gym just once a day is not enough. I need you guys to be mobile throughout the day, even if it's for 5 minutes at a time every hour or half hour. We need to be mobile. We need to be walking. We need to be, even if you got up and did jumping jacks. But I've seen some, when I like to try to guess my patient's age, but sometimes I have been truly blown away when I come across somebody who's in their late 80s or 90s. I'm going, oh my gosh, you look not a day over 65. Like, did you just get Medicare? It's just crazy. The difference, even in their thought process, the way they think, they're so positive and they love life and they're going out and seeing their friends every day and, you know, they're exercising. It's just, it's amazing. But we can do things that preserve our, you know, help with longevity, but we're just not doing it. Dan says, Doc, I love this subject. Really, Dr. Adkins covered most of this in the late 60s, but I still like listening to people like you to keep me on track. You know, poor Dr. Adkins, he knew stuff that way ahead of his time because there were really no studies back then. He just saw cause and effect. He did studies sometimes just with 1 or 2 people, and he followed them over time and said, oh my gosh, this works. But unfortunately, in the 60s or the 50s, the industry, the propaganda at that time was fat is bad for you. And that, because of that, Dr. Atkins couldn't escape. You talk about being, banished from the medical community. That was Dr. Atkins. In fact, if I recall, I remember one of his nurses was really heavy set, and she was seeing all these people, all the patients of Dr. Atkins getting healthy. And I don't know, I can't remember the story of how it ended, but I can't remember if she actually did it herself and got healthy, but she was way overweight, and she was actually witnessing all of his patients getting healthy, reversing their diabetes, losing weight. And I'm sure to be in that time, it's kind of like now, but not really. There's too many of us for them to just go after one. There are too many of us. We might not be high in number. The 95% of the doctors still are bamboozled and believe the buffoonery they were taught in medical school. And they're not even making money off of it. I mean, do you think doctors actually make money by prescribing you a medication? They don't. I mean, we might get some benefits from the drug reps. They bring you lunch or a soda or a bottle of water. There's no payments going on unless you are a speaker for them. And then that's top dollar. Okay. Pharmaceutical companies will pay doctors top dollar to speak for them and represent their product. That is big time buckos. Okay. So yeah, Dr. Atkins. Yep. He was going against the grain at the time, because they told us that you shouldn't eat fat. Shouldn't eat fat. You can smoke cigarettes. That's okay for you. But you should not eat fat, because fat makes you fat, and fat clogs your arteries, which it doesn't. It doesn't at all. Saturated fat does not clog your arteries. It's, as we were going back, the causes of coronary artery disease are inflammation and a clot. And neither one of those things involve saturated fat. Okay? So, Lacrosse Mom asks, what's your thoughts on whey protein for elderly? My dad, 90, doing okay with it, but mom seems to react. Creatine or collagen maybe? I know nothing, but need to get weight back on them. Lacrosse, I think they're fine. I think you need to be very cautious about which whey protein you are giving to your parents. I will tell you, if your mom is reacting, it's likely that she does not tolerate whey because of the casein and or the whey, but there could be casein in that milk product, because milk is whey and casein. And so if she is reacting, it might be to the casein portion of that particular product you are buying them. It is also processed. I know you think it's better than nothing, but whey protein is in and out of our body in an hour. It gives you quick acting nutritional value, but nothing long standing. So it isn't really going to put on a lot of weight. Okay. Is creatine good? Of course, creatine, I think, has some benefits. Collagen, I think it's a waste of money. I would rather have your parents chewing on chicken bones and getting the collagen off the chicken bones. But somehow they need protein. When people age, they become malnourished. They're malnourished mainly in their protein. They're not getting enough protein, and they're definitely not getting enough fat. So you would be best served by feeding them butter and bacon and eggs, and maybe giving them some MCT oil. And you could put that in your dad's shake. You could put a tablespoon of MCT oil in it. Again, now you're adding two fast energy sources, MCT oil being a medium chain fatty acid, and whey protein, which is quick acting. So you're basically just feeding him for the moment, and he's not really retaining those calories. But feeding them whole foods that are high in fat is in your best interest. like I said, even if they would, eat butter bites or, egg and beef muffins, you kind of put some beef on the bottom of a cupcake pan with like a pat of butter and then drop an egg and then bake that in the oven. I mean, even if they got one, but you need to make it more fat in their diet in order for them to get nutrition. They're not getting nutrition, and if there's no fat in their diet, then they're not absorbing any of their vitamins. So they're at a disservice. I would increase their activity. Increasing activity will cause them to want more intake of energy. So the more activity they are doing, walking or lifting or pushing, they will make them hungry. If they're just sitting, they're not consuming much or burning much energy, so they're not going to take in much energy. So older people, it's hard, but I see malnourished 50-year-olds as well. So it's not just an age thing. But you need to get your parents eating more fat and more protein and leaving the carbs alone, because the carbs are not nutritious. They're not even essential. They're worthless. Okay? You think that you're just giving them calories, but it's calories that are not doing anything for their brain, not doing anything for their muscles. So I would leave that alone. You're just giving them calories that do no good, and they're getting full on them. Okay? So you need to increase their fat. You start walking them and they'll get hungry. You start exercising them, start having them hold on to a band and pulling on it while you hold on the other end. Yeah, they're going to start getting hungrier. Get them to walk. Take them to someplace and get them to walk. Even if it's in the house, back and forth, back and forth. I don't know how active they are, but Dan Brown says, if you want to go back even further, Dr. Banting covered this idea way before Adkins. Yeah, I believe Dr. Banting was way back in the 1850s, maybe. Dr. Banting was way overweight. And he just kept thinking, I'm just going to, exercise. He was told, just exercise and just eat less calories. And he would get hungry and hungry and hungry. And then he would just choose to eat what I'm guessing was carbohydrates, because that's how he described it. And Dr. Banting kept getting fatter and fatter and fatter. And then one of his underscores told him, hey, maybe you should do this. So he went on a low carb diet and basically started losing all of his weight. And then he wrote this paper called, it was basically on obesity, corpulence. And yeah, they pretty much put an end to him. I think they killed him. I'm not sure, but he knew way back then that low carb diets. But you see all these, if the industry can't make money and the propaganda can't go very far if you guys are getting healthy, right? You're like their gravy train. You're pawns. You are on their sick train forever if you eat their food. You're like just giving into them. You're saying, when they say, anybody want to try this? You're like the first person to raise your hand and say, ooh, me. I'll try it. You're like Mikey. Mikey will try anything, even if it makes you sick. Tastes good. Well, it tastes good. And I'm really lazy. And cooking is just not convenient for me. Okay, then get your diseases. Then don't pout about it. Don't say, woe is me. I'm getting sick. Well, you caused your disease. Okay? That it is what it is. If you choose to eat those foods, you are choosing to take on the chronic diseases. It may not be right now, but it sure will be down the line. And so then you expect your doctor to save you, which they can't. Only Jesus can. So you expect your doctor to just give you medications. And the medications cause problems too. The medications, like a statin, increases your risk of having poor glucose control and increases your risk of having diabetes. And if it increases your risk of having diabetes, it's also going to increase your risk of dementia. Okay? We need fat for our brain. If you lower cholesterol with a statin or a PCSK9 inhibitor or whatever they're called, yeah, you're lowering your cholesterol. Every cell in your body, the membrane, is made of cholesterol. Do you think that God would have made a kill switch on you that if you got high cholesterol, you're just going to die at a certain level? I mean, that's craziness, right? But Some people believe it. You're welcome, lacrosse. Lots of meatloaf. There you go. But the sauce on the meatloaf is just plain sugar. So can you make meatloaf with just without the bread and without the sauce? Because meatloaf has carbs in it. So how about just do some ground beef or ground venison or ground bison or ground sheep or lamb and the ruminant meats and butter. Just melt butter inside of it. Put some salt. Yes, they need salt. Everybody needs salt. If you are salt restricting, that's the wrong thing to do. Okay? I would salt restrict refined salt. You do not need refined salt. That's bleached, refined, fake salt. You want to get good mineral salts. Okay? Everybody needs salt. Our body has salt in it. If you restrict it, your kidneys will try to retain it at all costs. If it retains sodium, salt, it is also going to retain water. And that is not a good thing. Okay? So I'm not sure why we ever got this thing with restriction of salt, because it's only causing more and more problems. I've seen it. I've seen it in both of my parents. They told my parents not to eat salt. Their legs blew up, started retaining water. And I see it all the time in my patients as well. Not as much in my patients because I tell them that they should not restrict salt. PB says, P-Bonkley. Can I just call you PB from here on out? Would you repeat your phone number for a video consult? I absolutely will. It's 267 1961 1961 515-267-1961. And I think some of you who are listening right now have done consults with me. Dan says, I love that you know the story of Banting. I believe it was called A Letter on Corpulence. That's exactly what it was called, Dan. Yep, that's exactly what it was called. At that time, eating low carb was called banting, like a verb. Yes, it was. Are you banting? Yes, I'm eating low carb too. Oh my gosh, could you believe the little club they have back then? That would have been amazing. But now we have much bigger clubs because we have social media. Because obviously, because I'm such a small fry. If you are listening to me, I'm guessing you're listening to Dr. Berry and Dr. Chafee and Dr. Ovadia and Lisa Wiedemann, Dr. Wiedemann, and Nutrition with Judy, and who else? I mean, there's Paul Mason, there's oh my gosh, I probably could name off 20 or 30 names. Lustig, and I said Paul Mason. I always name my Australian guys first because I love their accents. But so if you're listening to me, I'm guessing you're also listening to them. Okay. Dr. Ben Bickman. Dr. Ben Bickman is amazing. He wrote a book, Why We Get Sick. He is a PhD out of, it's BYU. I think it's BYU. Dr. Ben Bickman. He's so smart when it comes to talking about fat and insulin and metabolism. It's just amazing. And recently I started listening to the lectures by Malcolm Kendrick. Oh my gosh, that man is brilliant as well. Sometimes when we get so smart, not really, but you get smarter, you start poking holes in stuff they'll say. For instance, he was talking about the gallbladder one day, and he was talking about the gallbladder making bile. And I'm just going, oh, Malcolm, Dr. Malcolm, you did not just say that. You didn't mean that. See, when we talk, we just start talking, and sometimes we don't even know what we're saying. But the gallbladder does not make or produce bile. It stores bile, okay? So even if you did not have your gallbladder, which you should keep, but if you didn't have your gallbladder, you still make bile, and a tiny little part of your tiny little part of your small intestine will kind of pouch out and store just a little bit of bile. So if you do not have, if you don't have a gallbladder and you want to go carnivore, just go at slow. You might want to even eat smaller, frequent meals to get your to get your bile start secreting again. Because once your bile is secreted on a regular basis, it'll continue to go. Okay? And you need bile to take care of the fats. All right? Okay. The gallbladder, that was a great question. You guys know why we have gallbladder problems, right? Because they told you that a low-fat diet is healthy. And so your gallbladder, in order to work, needs fat in your diet. And if there's no fat in your diet, it gets lazy and it starts to just be floppy. And that's when bile sludges up and forms gallstones. And then the minute you eat a fatty diet, it'll start contracting, trying to contract, start working. And yeah, that is not a fun situation because you're trying to push like thick oil, like sludge through the common bile duct, and that hurts. And so you'll think you're having a gallbladder attack, which you likely are, but you did it to yourself by eating a highly processed carbohydrate diet, and your gallbladder got sick and started wasting away. And then when you started getting on a healthy diet, you asked the gallbladder to just start working again. It's kind of like you've never worked out and then you go and do a 2-hour workout and expect not to be sore. That's what you're doing to your gallbladder. Some people take ox bile initially, like the first 1 or 2 weeks, to help them take care of the fats a little bit easier, but I wouldn't do that on a regular basis. Okay, you guys, looks like that is it for the questions. We've been talking for about an hour and a half, so it was good to see you guys. And I hope you have a good rest of your Sunday. If like I said, if you have questions or want to share this, please share it with your family and friends. You know, if I'm helping you, you'd never know. I could be helping somebody else, but we wouldn't know that unless we're sharing. So give a thumbs up, like, share, do the thing. Right on? Okay? So you guys have a good rest of your day, and we will meet back every Saturday at 9 a.m. Central, and that's on Instagram and Facebook. Sundays I reserve for YouTube and Instagram, and sometimes during the week I will hit a YouTube. But the reels are every day, so check those out and keep learning, you guys. Keep learning, keep believing, and we'll go from there. Have a great rest of your day. See you guys.